Let's learn about the movements of the synovial joints of the body. Most of the body's joints are synovial joints, which are diarthrotic or freely movable. Synovial joints have different shapes that allow for different types of movements. Let's begin with the shoulder and hip. The shoulder and hip are both ball and socket joints. The movements of the shoulder and hip include flexion, extension, abduction, adduction, internal and external rotation, and circumduction. Shoulder flexion consists of moving the arm forward in a sagittal plane. Extension consists of moving the arm backward in a sagittal plane. Shoulder abduction consists of moving the arm away from the body in a coronal or frontal plane. Adduction consists of moving the arm toward the body in a coronal plane. Internal or medial rotation consists of twisting or rotating the arm inward. During external or lateral rotation, the arm rotates outward. Circumduction consists of tracing a circle with the distal portion of the arm. Hip flexion consists of moving the leg forward in a sagittal plane. In hip extension, the leg moves backward in a sagittal plane. Hip abduction consists of moving the leg laterally or away from the body in a coronal or frontal plane. In hip adduction, the leg moves toward the body in a coronal plane. During internal or medial rotation of the hip, the femur twists or rotates medially. Notice that the lower leg moves outward during internal rotation of the hip. External or lateral rotation consists of the femur twisting laterally. Notice the lower leg moves inward during external rotation of the hip. The elbow joint is a hinge joint between the distal humerus and ulna. The movements at the elbow include flexion and extension. However, additional movements of pronation and supination occur at the proximal radio-ulnar joint. Elbow flexion consists of bending the elbow. Extension consists of straightening the elbow. Supination consists of externally rotating the forearm, so the palm of the hand faces upward. In pronation, the forearm internally rotates, so the palm of the hand faces downward. The knee is also a hinge joint. The movements of the knee include flexion and extension. In knee flexion, the knee is bent. Knee extension consists of straightening the knee. The wrist is a condyloid joint. The movements of the wrist include flexion, extension, radial and ulnar deviation, and supination and pronation. During wrist flexion, the wrist bends forward. In wrist extension, the wrist bends backward. Ulnar deviation of the wrist consists of bending the wrist so the little finger moves toward the body. Radial deviation consists of bending the wrists so the thumb moves away from the body. The ankle joint is a plane joint. Movements of the ankle include dorsiflexion and plantar flexion. Movements of the foot include inversion and eversion. Ankle dorsiflexion consists of bending the ankle so the toes point upward. In ankle plantar flexion, the ankle bends so the toes point downward. Foot inversion consists of moving the foot so the sole of the foot points inward. In eversion, the foot moves so the sole of the foot points outward. There are two types of joints in the spine. Fibrocartilagenous joints are located between the bodies of adjacent vertebrae. Synovial joints occur between the articular surfaces of adjacent vertebrae. The movements of the spine include flexion, extension, right and left lateral flexion, and right and left rotation. Spinal flexion consists of forward bending in a sagittal plane. Spinal extension consists of backward bending in a sagittal plane. Right and left lateral flexion consist of bending the spine to the right or left in a coronal or frontal plane. Right and left rotation consist of twisting the spine to the left or right. Special thanks to Grace Forciea for producing the animations for this video. We hope you have learned something about ranges of motion, and see you next time.